Hello everyone, my name is Dr. Amanjit Singh. I am the Director and Head of Colorectal Surgery at Medanta, the Medicity, Gurgaon. So today we'll discuss about colorectal cancers, which is kind of a disease which is increasing like an epidemic in India. So colorectal cancer, if you see our intestinal tract, so from mouth to the anus we call it as a gastrointestinal tract. So last 150 centimeter is our colon, and out of which is 1.5 meters. So out of that, the last 15 centimeter that we call as a rectum. So colon and rectum, they are kind of the similar kind of pipe. So the cancers which develop in this part of the colon, we call it as a colorectal cancers. Regarding who is at risk, so there are some kind of risk factor: patient who have a family history of colorectal cancer, those who have a family history of associated cancers like ovarian cancer, breast cancer, those who have a personal history of colorectal polyp. So what polyp is? Polyp is like a growth which arises in the colon. So the colorectal cancer, they develop from the polyp. So anybody with a history of a previous history of a colorectal polyp, or those with a history of inflammatory bowel disease. Inflammatory bowel disease, inflammation of the inner lining of the colon, like ulcerative colitis, Crohn's disease. So these are kind of some kind of people like inflammatory bowel disease, those with personal history of some other cancers, those with family history of colorectal cancer, or some kind of a genetic syndrome. So these are kind of high risk group patients who are at more risk of colorectal cancers. So colon cancer is a specific cancer which arises from polyp. So polyp are like small growth of mucosa inside the colon, and there is a time period of around 3 to 5 years for polyp to develop a fully blown cancer. So this is kind of a window of opportunity for us to detect these patients and remove the polyp just by a simple endoscopic procedure. So that is the reason we advise screening to all patients. If you see in America, it was earlier done at the age of 50, but now since the last 3 years, the American Cancer Society, they have decreased this age to 45 years, considering the recent increase in number of colorectal cancer in young adults. So in India, we have some shortage of healthcare system, population is there, so normally we do not advise, it's not possible to screen all patients more than 45 years. So in India, we advocate screening to people more than 45 who are in the high risk group, or those who have, we call them as a warning signs or a red flag signs. So like you said, colonoscopy is the ideal method in which we can go inside through a pipe and we can see the area directly. So it's kind of a 100% accurate. So, but this is invasive, it includes cost and can be done only in a specialist center. So apart from colonoscopy, if you see basic test, even simple doing a hemoglobin and a iron level. So if somebody has a iron deficiency anemia, so he or she is more prone, that indicate that we should screen this patient further. There are some other tests like fecal occult blood test, which we call as a stool test. So if somebody has a stool blood positive, so these are the patients in which you need an invasive screening. Recently, we have got some immunohistochemical tests in the feces also, but they are not yet fully available all over India. But I think in the near future, we are going to get all those tests also. If you see, earlier it was thought to be a disease of people who are more than 60. But now recently we have seen young adults, even to the age of less than 40s, especially in India, which are people who develop colorectal cancer. Though the majority of these, they have a genetic cause, but the change in lifestyle, diet, so they all add up to the developing colorectal cancer. So that is why somebody who is in a high risk group, we advocate them to get screening even at the age of 40 or 45 also.